Welcome back to another episode of Doctors Go Live with me, Nina Shahril Khan, your host. And today we are talking about something that happens to the best of us, common sports injuries and their recovery. So tell me who is tuning in right now. Drop me your name and where you are watching from in the comment section because we want to hear from you. All right. And of course, what would you love to learn in today's episode? Is it about sprains, muscle pulls, rehab, or how to know if you need surgery? All right. So type your questions below. We're going to answer them during the Q&A at the end. Now, who is excited to win some prizes? Now, if you share this video out right now, you'll be eligible to join our Doctors Go Live quiz, which is happening right at the end of the Q&A. And yes, we have got some exciting prizes. And today it happens to be laptop bags, which are up for grabs today. So hit that share button, tag your friends, and stay with us until the end because you just might win those awesome prizes. All right. Now, all this is happening right here in Doctors Go Live with me, Nina, and our special guest for today. Now, let's talk about what we're going to be talking about in today's episode. Maybe you have sprained your ankle before during a futsal or pulled a muscle at the gym, or maybe you're just very stiff after the gym, or even if you have twisted something just chasing your kids around the house, you are not alone and you're definitely not broken, okay? But what is the right thing to do next? To help us break down all of it from injury to recovery, we're joined by none other than Dr. Gayathri Arumugam, consultant orthopedic surgeon from Columbia Asia Hospital, PJ. So grab your notepads or just pay attention and stay till the end for our quiz. And don't forget to share this video because someone might just benefit from it. All right. So all this is happening right here on Doctors Go Live. Hey, welcome, Pradeep, Maureen, Raja Lakshmi, welcome to the show. So nice to have you guys. All right. So remember to tag your friends because someone might need it, because this episode might just make a difference to somebody out there. But first, let's take a look at this short video and we will be back with Dr. Gaya. All right.
From weekend warriors to pro athletes, sports injuries are more common than ever. One wrong move and you could be out for weeks or risk long-term damage. The good news, with proper care and early action, most injuries are preventable and treatable. I'm Dr. Gayathri Arumugam, consultant orthopedic surgeon at Columbia Asia Petaling, Jaya, and I've helped hundreds of patients get back to their game stronger than ever. Join me in the next episode of Doctors Go Live, where I'll walk you through the most common sports injuries, how to manage them and when to seek help, and what you can do to prevent them from happening again. It's all happening on Wednesday, 24th September 2025 at 3 p.m. So whether you're an athlete or just chasing your kids around the house, be sure to catch it.
Wasn't that amazing, guys? Now, if you have just joined us, you are watching Doctors Go Live with me, Nina Shahril Khan. And today we're diving into a super relevant topic, common sports injuries and their recovery. Now, whether you're a gym junkie or a weekend sports warrior just about to start and you accidentally twisted your ankle or something, this is the episode you want to pay attention to. So joining us to break it all down is our special guest for today, Dr. Gayathri Arumugam, consultant orthopedic surgeon from Columbia Asia Hospital, Petaling, Jaya. Welcome, Dr. Gaya. Hi.
Thanks for having me.
No problem. Thank you so much. I think I have to say this is one of our most gorgeous doctors we have ever had on Doctors Go Live, right? So let us know. And Doc, I think you've got a fan here. Pradeep says, as you can see, tuning in for my awesome go-to ortho, Dr. Gaya. So I think that's your one of your clients, right? Doc?
Yeah, one of my friends.
Client or patient? One of your friends. Awesome.
Yeah.
Awesome. Yeah. Okay. And we've got Raja Lakshmi tuning in from Bandar Sanwi. Thank you, guys. Keep it coming. Let us know who's tuning in and where you're tuning in from. All right. Okay. Doc, welcome. Thank you for joining us.
Sure. It's my pleasure to join you today.
Okay. Now, before we begin, just before we jump to the juicy questions, just a reminder, the Doctors Go Live quiz is happening right at the end of the show where you could win some prizes. So please pay attention to our gorgeous Dr. Gaya today because you could win those prizes, all right? And if you have any questions, let us know in the comment section, okay? And we're going to get Dr. Gaya to answer them later. So let's get started. Okay, Doc. Could you start with sharing us about yourself, what you do, and how did you get into orthopedics, and what exactly do you do? Yeah.
Okay, so as you've already introduced me, my name's Gayathri. I'm an orthopedic surgeon, currently now in Columbia, Asia, Petaling, Jaya. So my main focus is knee, foot, and ankle, ranging from arthritis, ligament injuries, and sprains. All right. I also, of course, do the bread and butter of orthopedics, trauma management, fracture fixations. Now, the answer to your question of why I chose orthopedics. Okay,
Yes.
so when I first joined orthopedics posting in my medical school, I was told that this field is mostly for males and it's not very suitable for females. Now that
Really?
immediately tweaked my interest, and I
Uh-huh.
decided I am so going to pursue this and I'm
Uh-huh.
going to do it well every day.
Mm-hmm.
That's the main reason I chose orthopedics. And the thing about ortho is that it's instantly gratifying. So patients come in with pain, they can't walk, they can't play sports. You're able to immediately fix them and relieve them of their symptoms, and you actually see them walking out happy, and you feel gratified and satisfied. That's the main reason I chose ortho.
Okay, got it. And another question, Jack. So is it true there's not a lot of ladies in ortho then? Is it only
Well, now
men?
more and more ladies are joining Auto now. But 20 years ago, when I first joined Auto as a houseman, a medical
Mhm.
student, sorry, 20 years ago, I was a medical student, yes. 20 years ago, not so many females, no.
Okay.
But now we have a lot joining, and we have a lot of pioneer female orthopedic surgeons in the industry who are very encouraging as well to recruit new female surgeons. So, yeah, it's much better now compared to those days.
Wow, so you're one of the trailblazers. And you know what, guys? I mean, I look at her, she looks like she's very young, not a lot of years, but 20 years. Can you imagine that? So
As a
there
houseman,
you
20 years.
go.
Yes.
Yeah,
Medical
20
student, but
years.
I keep saying it wrong. Yeah.
So you can rest assured, definitely can trust her advice, right? 20 years doesn't look like it.
Yeah, I'm glad that you are focusing on that. Yes.
Yeah. Because she herself looks like a 20-year-old, right? Okay, never
Oh,
mind.
thank you.
All right, so let's get into it, right? Let's go. Okay, but before that, why is it important that we're having this conversation about sports injuries? What is it that you know that we might not
Okay.
know? Ah,
So I think it's important to talk about sports injuries because more and more people are getting more involved with being active, being healthy. They're going to the gym, they're going for jogs every day. And when they do these things and they get these injuries, they're not sure whether it's something normal or is it something concerning. Do you have to go and see the doctor? So talking about it, explaining what symptoms that need to bring you to the doctor, I think helps people become more aware of what happens when you have an injury.
okay, cool. So it's important that we talk about it. So yeah, if you're tuning in
Yeah.
right now, share the information because it's definitely going to be useful, right? So let's
Yep.
get straight into it. So let's go to the first slide here, Doc. Why is it
Yeah.
important to stay active, especially after COVID? I mean, I think a lot of people were staying indoors, but why is it important that we have an active lifestyle? Perhaps you can share with us.
So I think when you're talking about active lifestyle, you mean undergoing sports and going to the gym, things like that, isn't it? So there are a few
Yes.
aspects that gives you an advantage. So the first thing is, of course, the physical aspect. It
Mm-hmm.
regulates your body sugar. It reduces the risk of diabetes, high blood pressure. It keeps you healthy in general,
Mm-hmm.
helps you lose weight, helps you keep fit. So that's the physical aspect. There's
Mm-hmm.
also the mental aspect. As you know,
Mm-hmm.
exercise releases endorphins. So endorphins make you feel good in general. These hormones can help people combat anxiety, depression. It doesn't mean that if you have depression, you have to go to the psychiatrist, you have to start taking medication. You can try things like this. It also, exercise also regulates your hormones. For those who have PMS, things like that, mood swings, exercise helps a lot. All right.
Mm-hmm.
And the third
Mm-hmm.
thing, it also helps your mental focus. It increases your mental acuity. I've
Mm-hmm.
seen a lot of patients after regular exercise, they become more mentally alert. So
Okay.
so many aspects of exercise.
Mm-hmm. All right, wonderful. So it sounds like there's a lot of benefits. I would have thought so based on what you said earlier, is it true that a lot of Malaysians are taking up more fitness and sports, or are we just very hooked onto our roti canai and teh tarik? I'm
Hey,
just
we're
wondering.
definitely hooked on to roti canai and teh tarik. That's not going to stop anytime soon. But
Uh-huh.
what I've noticed after COVID, especially, is a lot of us are actually very health conscious. You go out in the
Mm,
evenings now in my own command, I can see people jogging so much more, people walking, jogging,
okay.
cycling. So many people are on the road exercising. Last
Okay.
time, you go to the gym, it'll be half empty. But now it's so difficult to get into a machine. So Malaysians are actually exercising more and more, which is a very
Okay.
good thing, which is a very good progress.
Uh-huh. So the only thing is there's also more injuries, I guess, with it. So I think that's
Yeah,
wonderful
there is.
data to
Yeah.
to learn. So that's why it's important that we talk about today's
Yeah.
topic. So now that we know the importance of exercise, what are some common sports injuries that you see happening, coming into the hospital that you could share with us?
So I would say the most common injuries that I see is still the knee, followed by ankle injuries and shoulder injuries as well. So you get sprains, ligament tears. Very rarely in sports injuries you get fractures lah, if it's a very high impact injury. But yeah, these are
Mhm.
the most common things.
Okay, so we're talking sprains, knee injuries, ankle injuries,
Yeah.
and also
Shoulder
this.
injuries. Yeah.
Okay.
Fractures and dislocations you can get, but a bit more, not as common as ligament injuries. You also get your overuse injuries like tennis elbow, shin splints, and stress fractures as well.
Okay, got it. Are there certain sports activities that tend to result in more injuries? Just wondering.
Yeah, definitely. A lot of the knee
Mm-hmm.
injuries are actually a result of football, futsal, badminton, and now the
Mm-hmm.
new craze pickleball. That also
Ah,
has been causing some injuries because of
okay.
the sudden movements, the jumping movements. All those things are causing these ligament injuries.
Okay. And which injuries do you think people tend to ignore more? Like they'll just walk it off. It'll actually, it'll be fine. Time will heal, but it actually turns out more serious. Just wondering.
So you see, the thing is, I think the one that is ignored the most are the ankle
Mm-hmm.
injuries because a lot
Mm,
of people are aware regarding knee injuries. They know what is the ACL. There's a lot of TikTok videos about the knee, and then there's a lot of professional footballers who get ACL injuries, meniscus injuries. So people are aware. The knee has these
mm,
ligaments. These can get
mm-hmm.
injured during sports. If I
Mm-hmm.
have knee pain, I need to go and see an orthopedic surgeon. But ankle, on the other hand, is very ignored. A lot of
Mm-hmm.
people injure their ankle, they think it's just a sprain and they leave it alone. Actually, I get a lot of patients coming in with repeated falls, repeated ankle sprains, and finally they get ankle instability. Only then they
Oh
come to
my
see us.
goodness.
Yeah, so I think ankle is the
Wow.
one that is usually ignored.
Okay. All right. So take note, yeah, guys. Ankle. Any of your friends ankle injury, make sure you lecture them. All right, or
You
just
should
send
check
them
it
the
out.
link.
Yeah.
Yeah,
Yeah.
or just send them the link to this video. Okay, easier. No need to talk. Kind of thing. All right. And okay. So what should people not ignore when it comes to these injuries? Just wondering.
So when you exercise, you definitely will have some pain, some discomfort, all right? So
Mm-hmm.
how you need to differentiate it from something more sinister is if there is prolonged swelling of the affected area for a few days, swelling is not going down. If it's your lower limb, you're not able to step on it. If you try to walk, it hurts a lot. Those kind of things, you need to go and get it checked out. Oh, another thing
Okay.
is if you
Uh,
start walking after an injury, your knee or your ankle feels wobbly, it's not stable, it keeps giving way, yeah, then you need
mhm.
to get it checked out.
Okay. And in your experience, a lot of people don't come in for those things.
Yeah,
What
yeah, they
happens?
do. Because sometimes people actually they're scared to come. That's the main
Okay.
thing. And
Why
there's a
are
lot
they
of
scared? Just wondering.
because a lot of misconceptions. People think that if you come and see the doctor, I need to go for surgery. Let me just wait and see if it becomes better by itself. So
Uh-huh.
those kind of things. Yeah.
Okay. So it doesn't go to surgery. What actually happens when they come? The
So
reality. I
not all
mean,
sports, yeah, reality is not all sports injuries need to result in surgery. A lot of
mhm,
it, sometimes if it's incomplete tears, you can actually treat it very well with proper rehabilitation and physiotherapy. Only
okay.
only some injuries result in surgery. I wouldn't deny that surgery sometimes is required, but not
Mm-hmm.
all.
Okay, okay, okay. So I think rather than just be scared and stay and then let the thing simmer, just take a
Just
look,
get it checked
go,
out. Yeah.
yeah, get it checked out. Because
Yeah.
most of the time it's not going to go to surgery, at least not yet. Okay, but if you do keep playing with the injured thing, then definitely you're going to go for surgery, I
Yeah,
guess,
that's
right?
another thing. If you have
Mm,
an injury, like for example, let's say you have an ankle injury, a complete tear, and you've
mm,
had repeated falls. Now, the more times that you have the fall and the longer you walk with an unstable ankle, the more chances of further ligament injury and cartilage
mm.
injuries as well. Now, this can lead to more long-term problems like ankle arthritis. So, to stop all of this from happening, just get it checked out.
Okay, and I guess that's one of the biggest misconception about sports injuries, right?
Yeah, that's right.
Okay, cool. So now that we know what the common injuries are, let how do we prevent them? I mean, can it be prevented or it's impossible? Just wondering.
I mean, it can be prevented, but there are a few things that you can do. So I always divide it to things you do before your exercise, during your exercise, and after.
Okay,
So
that's
before
good.
your exercise, yeah, remember to warm up properly. Don't
Mm-hmm.
go from zero to hero, is what we call it lah. So try to do strengthening exercises in general before you go like on a 10-kilometer run. Warm up first, do stretches first. All right, that is before your exercise. Now, during your exercise, make sure you are well hydrated. You use proper footwear, proper gear, and don't overdo it. Listen to your body. That's during your exercise. All right.
Okay.
After your exercise, don't forget to cool down. A lot of people forget the cooling down part. They go all out. They run 10 kilometers. They do hiking, whatnot, but they don't cool down. They don't give a chance for their muscles to relax. So that
Mm-hmm.
needs to be done as well.
Wow. Okay. What happens if you don't cool down properly?
Your muscle doesn't have enough time and enough. You don't give it a chance to cool down. You don't give it a chance to heal itself properly.
Okay. So
Yeah.
then what happens? Do they
It's an
become stiff?
overdrive, and then sorry, yeah, you result in stiffness. That's basically what happens. Soreness,
Ah.
stiffness, yeah.
Now I know what happened to me at the gym. Thank you. Because I was like super stiff. Okay, and you mentioned just now that you need to properly hydrate. Why is that? How does that prevent? Just wondering.
So I think you have to be properly hydrated so there is less risk of dehydration in general. Now, if you get dehydrated, you get very tired, you get muscle fatigue. If you get tired and you get muscle fatigue, now this predisposes you to further injury. You're not as alert, your muscles are not as alert. So these kind of things can increase your risk of getting injured.
All right. Okay. So in the meanwhile, if you guys are hearing what Doc is sharing and you have questions you want to ask, please share your questions in the comment, and we're going to answer them at the end. Okay, of the Q&A kind of thing. You were okay. So any other ways to prevent sports injuries, Doc?
Yeah, I think another thing that maybe I should focus on is I did speak about footwear. So, for example, when
Mm,
you're running and you're jogging, please do use the appropriate shoes. We have specific running shoes and jogging shoes. Those of us who have flat feet, make sure you use specialized feet with the proper arch because that will
mm-hmm,
reduce your strain and reduce the after effect on your muscles. And for example, racket games, you make sure you use your rackets which are of proper size. If you use
mm,
rackets which are too big, then you're straining certain muscles too much. Those kind of things can
mm.
result in even more injury, even more pain. It's all small, small things which adds up to a huge symptom.
Right. Okay. It builds up, I guess, right?
It builds up. Yeah, exactly.
Okay, 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 got it. Yeah. You mentioned just now flat foot. How do we know if we have flat foot? And if we have that flat foot, right? What happens? Just wondering. And do a lot of Malaysians have flat foot? That is a lot of questions on flat foot.
Yeah, yeah. I think a lot of us have flat feet.
Uh huh.
So, how do you diagnose flat feet? I think from a layman's perspective, you can actually see that your arch on the inner
Mm-hmm.
part of your feet is flat. It's supposed to be like that, isn't it? So some
It's
people
supposed to
it's
have
flat.
that curve, right?
Yeah, some people it's
Okay.
flat and their
Mm-hmm.
leg sort of points outward like that.
Mm-hmm.
All right. So I don't
Mm-hmm.
have a model now to show you, but that's what flat feet is. But to get it diagnosed, you need to see an orthopedic surgeon. All right.
Okay, got it. And
So
and
when
what
you have
happens?
flat feet,
Yeah.
yeah, so you get pain because your stress over the feet is not equally distributed when you walk and when you run. So
Mm-hmm.
certain areas are in more stress and certain areas are having less stress. Now this predisposes you to developing calluses, corns, chronic pain. So that's what flat feet is.
Okay. And for those who are tuning in, they don't know what callus or corn is, or they're mixing it up. What are those? What do they look like?
So
Just want to.
callus is basically thickening of your skin on the sole of your
Okay.
feet. So
Uh-huh.
just think of it as a certain area is working extra hard, okay, because there's more stress on
Oh,
that area. So your skin becomes very thick. Now, when it becomes very thick, it starts hurting because it's like a
okay.
little stone in your feet, you know. So every time you step
Mm-hmm.
on it, it just hurts. That's what
Mm-hmm.
callus is.
Mm-hmm.
Callus can also become a corn. Corn is something a little bit more specific. You know, you
Uh-huh.
can use what they say in Malay is anak mata, right?
Ketuat.
Ketuat,
Oh,
yes, that's what it
ketuat.
is.
Okay, okay, okay. Uh-huh.
Yeah. So
So
that's what a
it's
corn
like a
is.
bulge or
It's
something,
round
is
with a
it?
little eye on it.
Okay. And what are those? What do you need to remove them or what?
So it depends on the cause of the con. Con
Mm-hmm.
can be because of just unequal distribution of pressure, but
Mm-hmm.
sometimes it can be because of other things. It can be a viral infection as well. So you need to get it checked
Oh,
out by a doctor first
okay.
before deciding how to treat it, whether it needs to be removed or whether you just use a corn plaster. We need to find out what's causing it first.
I see. Okay. And it's quite common, this corn thing?
Oh, it's very common, yeah.
Okay. Um, kind of thing. All right, cool. And I guess if you have flat foot, it's really important that you have the proper gear.
Yeah, it is really important because if not, you'll just be in constant pain. And
Okay.
this will limit your activities, limit the way you run. You start standing in different postures. Now this leads to stress in other areas. You might get hip pain, you might get back pain, things like that. So if you have flat feet, you really need to get the proper footwear.
Okay, got it. What about yeah, I think this is the second slide. Do you want to share about this, Doc?
Yeah, so how to prevent sports injuries is something like what I was telling you. So you avoid overtraining, balance your activity.
Mm.
Don't rest for 2 weeks and then one fine day decide to go to the gym for 3 hours. You know, that's overtraining. Yeah.
That sounds like
And
me.
sounds like
Oh,
me too. Okay.
okay. Like over
So
ambitious, right?
yeah. And then listen to your body. If
Okay.
it's very painful, okay, a little bit of pain, like I said, is normal. You can push through it. But if it's like excruciating pain, please stop. Rest. Don't
Okay.
push through.
Okay.
Yeah,
Okay.
and don't forget about core training, core muscle training, strength training. You need to strengthen your muscles to be able to be to build your stamina. So don't
Okay.
forget about things like that.
Okay. So it's not just cardio. Look into
It's not just
muscle.
cardio exactly. Yeah, you need to do strength
Okay.
training as well.
Okay,
Yeah.
got it. Doc, one more question. When you say, what's the question? Okay, you say balance activity with rest and recovery. Some
Mm,
people they say, well, every day enough can go to the gym, kind of thing, and I don't know, maybe they overdo it. What is
mhm.
overtraining and what is undertraining, and how long before rest? Just wondering.
So it's different for everyone.
Mm-hmm.
Yeah, so I don't know if you ask a footballer what is
Mm-hmm.
normal training for him will be is to go for a run every day. But if you
Yes.
ask me, for me, go for a run once or twice a week is sufficient already. So it depends on
Correct.
you. It depends
Uh-huh.
on your stamina level, your daily activities, the kind of sports that you do. But the
Uh-huh.
most important thing is if you're overtraining, you'll have a lot of pain. All
Okay.
right. If you have a lot of pain, which is just not going down with rest, it's either you're overtraining or you injured yourself.
Right.
So that
Okay.
is how
Okay.
you got to stop and think back. What am I doing wrong? What am I doing different? Am I
Mm-hmm.
overtraining or have I actually injured myself? So it's actually a very case to case basis. There's no general rule that this is overtraining, this is undertraining. It depends on the person, type of sports you do, and how
And the
active the
goal as
person is
well.
in general. Yeah.
Like, I mean, if you're a sportsman and you're a footballer, obviously you need to train every day lah. But if
Yeah.
you're
Yeah.
hurting every day, that should be
Yeah.
something's wrong lah kan? Kind of thing.
That's right. That's right. Yep.
Okay. And I guess that's where the listen to the body is very important.
Ah, yes. Very important.
Got it. Do you have any advice for, like, those weekend warriors or first timers, like you say, like they go AWOL for 3 weeks, suddenly they're at the gym,
Ah,
who
yes.
goes all out after long break? What's your advice now?
So I know it's difficult to maintain a consistent workout routine. Definitely, it's difficult for all of us. But when you find the time, you do it in the weekend. That's why we call it weekend warriors. Try
Mm-hmm.
not to go, like I said, from zero to hero lah. Take it
Ah,
slow,
okay.
step by step. Progressive increase in your okay, let's say you're a runner or you're jogging. Maybe you decide today I'm going to do 3 km. Tomorrow I'm going to increase to 3.5. Now, if it's hurting, then you go on to 3.5 the next 2 days and then slowly increase to 4. Things like that. Don't suddenly, after 2 weeks of not running, you straight away go to 0 to 5, lah, without stopping, without resting. You'll definitely injure something. You definitely will rupture some tendon. So
Okay.
that's what I mean by take it slow.
Okay, got it. And I think the Malays will say kerja gila, so don't buat kerja gila. Okay,
Yeah, exactly,
kind of thing.
exactly.
Okay, another question. We're gonna go to the opposite side. The people
Mm-hmm.
who's very like COVID-like people during
Mm-hmm.
the lockdown where they don't
Okay.
exercise. What
Okay.
should what's the minimum, or because it's important to have a healthy or active lifestyle? What's your advice? How often? What's the minimum they should do? How often and what kind of exercise? I guess.
I think like I said, it's very tailored to each person. But a general rule is what I believe you exercise 3 to 4 times a week. You exercise, and
Mm-hmm.
each time at least 30 minutes. This is the bare
Okay.
minimum lah.
Okay, three to
So
four
I
times. Okay,
think
I think that's
this
pretty
would be
doable.
a healthy amount.
Okay, because it's important to get that blood flowing and stuff like that, right?
Yeah, yeah,
Okay,
that's
cool.
right.
Let's go to the next slide then. All right, then the biggest question is once
Mm-hmm.
you know how to prevent, let's say already happened the injury, when do we seek medical treatment?
Okay, so very important is your pain and your swelling. Pain lah doesn't improve with rest. So sometimes when you exercise, you get DOMS, delayed onset of muscle soreness. That means you run like crazy today, and then tomorrow you start getting all this muscle ache. Now DOMS should go down about 2 to 3 days for most people. If
Mm-hmm.
your pain continues for a few days and you can't even step on the leg and it's swollen, something's not right. Then you need to go and seek medical treatment. Yeah,
Okay.
inability to bear weight. That's a very,
Mm-hmm.
very important red flag. You definitely need to see a doctor if that happens. And
Mm-hmm.
then in some patients, you'll have visible deformity. Of course,
Mm-hmm.
most patients don't keep quiet when there's visible deformity, lah. But
Mm-hmm.
just to tell you, if something looks not normal, like there's something broken or something, please just come immediately to see the doctor.
Okay. Mm-hmm.
Mm. And if you have any numbness or tingling at your lower limbs or your upper limbs, then you need to seek medical attention as well. You might have caused a slip disc in your spine.
Mm-hmm.
Especially
Oh,
for those who do all this weight lifting and all that, right? After you go to the gym, you carry weights, and then you come back home and you have numbness on your legs, radiating pain, sort of electric sensation. Yeah, you probably need to
mm-hmm.
get it checked out.
All right, so these are the important things to get it checked out
Yep.
lah.
Yep.
A lot of people tend to rely on Google or home remedies.
Hmm.
What's your advice in that? What's the risk, of self-treating sports injuries
I think the
based on
main
your
risk
experience?
main risk is wrong diagnosis because Google cannot examine your limb or your knee or whatever. Yeah,
Now
you come up with the
ChatGPT.
wrong. ChatGPT is even worse. Yeah.
Yeah,
So
exactly.
you get the wrong diagnosis, you do the wrong treatment. That is one risk. Second thing is you delay treatment, resulting in more damage. So that's why I wouldn't advise just Googling it
Okay.
or ChatGPTing it. Now that's the trend.
Okay. In your experience, Doc, are there any signs that people commonly dismiss that they should take more seriously? You know, with the cases
I
that you've
think
seen.
okay. So most of the time, if someone is in pain for a few days, they do tend to come and see us, all right, because it's
Mm-hmm.
debilitating. The thing that people ignore most often is instability, your
Oh,
knee instability
instability.
and
Oh,
yeah, that means you're walking and suddenly your knee just gives way. Yeah, it's
like
wobbly.
wobbly lah, like that.
Yeah, so sometimes people
Mm.
just attribute it to muscle weakness or, I'm not having good balance because I'm tired, something like
Mm-hmm.
that. So usually it's instability which is ignored,
Mm.
not
Does
pain.
does it happen all the time? Like when they're walking, the instability is the whole time, or they're walking and suddenly instability, then they walk normal.
So it
That's
depends on your
why.
injury. For
Okay.
ACL injuries, they always complain of instability. One, when they're walking on uneven surface, right?
Mm,
Maybe like
okay.
on
Uh-huh.
stones, and
Uh-huh.
or when you're climbing up and down the stairs.
I see. Okay. All
Yeah,
right. All right. Cool.
that's when.
Okay. Do you have any cases that's very interesting that you could share with us to give the audience, like, an idea and stuff like that?
Mm, let me see. Interesting. Okay, maybe
Mm.
I had a patient who was 50, very active, He's actually my friend. He's
Ah,
50.
okay.
He's very active, and he does exercise regularly. All right. He goes on hiking trips and all that. But one day he had his niece's sports day, and he decided to take part in the running competition. So he was all semangat to win, like, wanted to make his niece proud and whatnot. He ran, and his Achilles tendon ruptured.
Huh? Can I?
Uh,
Because this is quite shocking in the sense that because
yeah, but
he's
no,
fairly active,
yeah,
right? Okay.
yeah, he's active, but he
Uh-huh.
doesn't do running often. He does other kind of
Ah.
activities and didn't do warm-ups.
Mm.
So it caused an injury. Achilles tendon ruptured, and yeah, unfortunately had to end up in surgery.
All right. So, what's your advice if somebody is tuning in and they were about to impress their niece like that?
Mm.
So what's your advice?
Warm up first before you
Okay.
start your running or whatever competition that you want to get involved in. And if
Mm-hmm.
you know beforehand that you're gonna participate, maybe you start building up your muscles and start exercising beforehand.
Mm-hmm. And the other thing that is interesting to me is that just that's running. His
Mm-hmm.
type of exercise is actually hiking, right? Kind of thing.
Yeah,
And
yeah,
those
that's
are
right.
two different things. Just because you're active
Mhm.
in one doesn't mean you have the endurance and ability to do the other one, right? Kind of thing.
Yeah, but I think the more important thing here is you need to warm up lah. You cannot
Ah,
suddenly
okay.
just, sprint without any warm up.
Mm.
Yeah, you need to
Wow.
warm up
Okay.
first. Yeah.
Okay, so I guess that goes to our next question.
Mm-hmm.
Once we are injured, what does a typical recovery or rehab process looks like? I mean, maybe you can share the different types of injury and how we do recovery and stuff like that, or how you do it, not me.
All right. So there are a few scenarios. First thing is whether you have, okay, let's just talk about ligament injuries. Let's
Mm-hmm,
say it's an incomplete ligament injury.
mm-hmm,
So your recovery will depend on whether you're going to go opt for surgery or not. Incomplete ligament injuries, usually we don't treat with surgery, we treat conservatively.
mm-hmm.
So, but you probably need to be immobilized in a knee brace for about 4 weeks, right? After which you
Okay.
need to start physiotherapy, you need to start
Mm-hmm.
rehabilitation for the next 2 to 3 months. Is a
Wow.
very
Okay.
general timeline.
Uh-huh.
So it's a bit difficult to give a general timeline because each ligament is different, each person is
Mm-hmm.
different. It depends on the severity of the injury as well.
Mm-hmm.
So your rehab and physio really depends on each injury.
Okay. Like, especially if you're really active and suddenly you have to rest for 4 weeks and then do
Mm-hmm.
rehab for 3 months. Got cases or not where
Yeah,
your
definitely.
clients go mental
Oh,
because they
yeah.
cannot do the active lifestyle that they did? What's your advice on that?
They do get very frustrated because, like you say, they're very active, and the fact that they can't do their
Mm,
exercises, and they get frustrated. So, what I
mm,
advise is do other types of exercises. All right. So, for
mhm.
example, if you have a knee ligament injury, after a certain period of time, you still cannot do those exercises that they usually do, like maybe jogging, running. All you still cannot do, but you can do other things like strength training,
Okay.
swimming,
Uh-huh.
cycling. So I give them
Okay.
alternative types of exercises to keep their mind sane.
Okay.
Because if
Okay.
no
Got it.
exercise at all, then some of them might go
Yeah.
crazy.
Yeah.
Yeah.
That's what I
So you
said.
have to
Yeah.
find for alternatives.
Yeah, the way I see it is you've got all this energy and suddenly there's nowhere to go. I would go
Yeah, yeah,
mental
yeah.
kind of thing. All
Yeah.
right.
And you can ask them
Uh,
to focus on your upper body. You do your upper body core muscle strength training, things like that.
okay. And are there cases where they can immediately, and I think you did share that, they come in and see you and they can
Mhm.
immediately return to their normal activities? Are there such things?
Immediately return to normal activities after an injury is very unlikely. There's
Okay.
always a period that you need to rest and undergo
Okay.
rehabilitation. Yeah.
Okay. Kind of thing. And what role does physiotherapy play in recovery? Is it very important?
Oh, physiotherapy is very important. In some
Mm-hmm.
cases, the mainstay of treatment is physiotherapy because it's not surgery. Physiotherapy is the mainstay of treatment. So we always advise patients that you need to be very compliant to your physiotherapy sessions. Whatever is taught during physiotherapy, your exercises, you need to diligently do it at home every day. I tell my patients 2 to 3 times a day if possible. So yeah, physiotherapy is a very,
Mm.
very important aspect of recovery.
Okay. I would see
Mhm.
it as the new exercise, especially if you're recovering, right? That kind of thing.
Yeah. Yeah.
Okay. And what's your advice for, the people to continue to stay motivated during recovery, especially when it's long and frustrating?
So, yeah, I would advise them not to get frustrated. Just remember that
Okay.
every step ahead is progress and you will
Mm-hmm.
get through this. I always tell them what doesn't break you, you make you better.
Make
Always
you
makes you
strong,
better.
make you
Makes you
stronger.
stronger.
All
Yeah,
right, cool.
exactly.
Yeah, kind of thing. All right. And what about injuries in elderly people? Is that different?
Mhm.
What's your advice to the caretakers, or what's your advice to all of us who are aging? We're probably facing
In
things that we never faced before, right?
So in elderly, you need to be a bit more careful because there also comes the question of bone density, especially if the patient is female. Sometimes you may have osteoporosis, you may have brittle bones. You cannot afford to just slip and fall on the treadmill because this usually will result in some form of fracture, broken bone.
Mm-hmm.
So with elderly patients, you always need to be a bit more careful. Maybe if the person is able to have someone there with them while doing all the exercises, that would be the best. I'm talking about really
Right.
elderly
Okay.
patients, lah. Yeah.
But what if you're like from young, you've always maintained an active lifestyle, you're good with your cardio and your strength
Mm-hmm.
training, muscle training.
Mm-hmm.
Does that help as we age? Just wondering.
Yeah, definitely, definitely.
Okay.
It definitely helps if you have been consistent with your exercises. So even if you're
Mm.
old, like 60 or 70, you still can do those
Mhm.
exercises because your body is already accustomed to it, you know.
Right. Okay. So I
Same
guess
goes for
what?
pregnancy
Mm,
as well. Sometimes patients ask
uh-huh.
me, yeah, can I do these exercises? So this was actually my own research as well because I wanted to know whether I could exercise when I was pregnant. So what
Uh-huh.
literature says is that if you have been doing it consistently, you can do the same amount when you're pregnant as well. But please check with your obstetrician before you do anything.
Yeah.
This is
Right.
just a general information. Yeah.
I actually have a friend who's a gym freak, and she was
Mhm.
going through all this exercises when she was
Mhm.
pregnant. I think she just
Mhm.
didn't do a lot of those bouncy or
Mhm.
those
Mhm.
hard ones on the knees, but she
Mhm.
continued, and that helped with her losing weight as well when
Yeah, but always
after
check with your
delivery.
obstetrician first, lah, because each pregnancy is
Mm.
different.
Correct, correct, correct. I
Yeah.
think she got permission. All right, cool.
Ah,
So
yes,
let's
permission.
go, yeah, to our last slide. Doc, what is the take home message? If there's one thing you want viewers to remember, or several things when it comes to sport injuries, what would it be?
So I think the take home message should be is prevent your injuries with all the steps that I told before, before your exercise, during exercise, and after.
Mm-hmm.
And if you're injured, please don't forget to seek help early. Don't wait until more damage is done to your joints.
Right. Okay. Do not be afraid. Go and see. She's friendly and
Yeah,
pretty. That
I am.
helps, right?
Yeah.
Kind of thing. Right. In your experience, what are some of the most common mistakes or misconceptions people make when it comes to this topic?
I think the main misconception is that it will just go away. Your body will just heal itself. That's the
Uh-huh.
main thing. Let's just wait it out. That is one
Okay.
common misconception. Second misconception, all ligament injuries and sports injuries require surgery. That is the second misconception.
Okay, got
Yeah,
it. All right. So
yeah.
those two, it doesn't need
Those
to be
two.
that. Okay.
Yeah.
Any top tip for anyone trying to stay active without hurting themselves?
Sorry?
Any top tips for anyone trying to stay active without hurting themselves?
Without hurting yourself, listen to your body. Your body is always right.
Okay, got it. And any words of encouragement for people who are recovering, nursing themselves from an injury right now? Last
I think
question.
the same thing that I said. What doesn't break you only makes you stronger.
Okay, so
Yeah.
motivation and
Yes.
stronger kind of thing. All right, thank you so much, Doc. I think that was really amazing. We've got some amazing questions from people. So let's
All right.
step into the Q&A right now. So
Okay.
Maureen Lam has a few questions actually. The first question
All
is
right.
torn ligament. How long to heal?
Depends on the depends on
Ligament.
where the ligament is. You're talking about the knee ligament or the ankle ligament. But a
Mm-hmm.
general rule, if torn ligament, we don't treat it. If it's not a complete ligament tear, we treat it without surgery. Generally takes about 2 to 3 months to heal.
Okay, got it. And
Yeah.
that is with rest or physio
Definitely,
with
all ligament injuries has to be treated either with rest, rehab, physio, or surgery. Something has to be done. If nothing
okay,
is
got
done,
it.
then it's not going to heal.
Okay, got it. Thank you very
Yeah.
much. Also from Maureen Lam, what do I need to do when I twist my ankle? Thank you very much to the other viewer who corrected because I was when I test my ankle, when I twist my ankle.
So when you twist your ankle, if the
Mm-hmm.
pain and the swelling doesn't go down in a few days, you need to get it checked out. Make sure you don't have a ligament injury. Don't just leave it
Ah,
alone and attribute it to a normal sprain.
all right, awesome. So Maureen is saying, okay, got it, doc. Okay, and
Okay.
we've got another question from Chia Guat Hua. Why my leg feel very tired while walking up the hill? Is this common?
Um, okay, your leg is probably tired because your muscles are not used to walking up the hill. So you need to build up your muscles, do some core strength training so that it's stronger. And when you walk up the hill, you don't have so much of muscle soreness.
Okay.
Yeah.
Guat Hua, if you have like a follow up information to that as well, do let us know. Kind of
Mm.
thing, yeah. And Maureen is asking about flat foot and how do bunions occur in the foot. So we're gonna do that together. Maybe you can quickly recap flat foot
So
and
as I
bunions.
explained just now, yeah, flat feet is when you do it when you have loss of your medial arch of the foot. That means the inner arch of your feet is flat. That is what flat feet is. How bunions occurs it, some people have it, they're born with it. The deformity is already there.
Oh, okay.
Sometimes tight, narrow shoes can also cause bunions as they develop.
Hmm. Okay.
Yeah. So those two things.
And these bunions, those are the ones like kind of stick out near the toes, is
Yeah, your
it?
leg goes like no,
Ah,
they don't
is it?
stick out. This is your toes. One toe
Uh-huh.
just goes like that. Yeah.
Or sing it like that.
Yeah, sing it exactly.
Okay.
Is there a
So do
picture
you
for
need to do anything with the bunions or
Okay,
how?
so bunion treatment, first, we don't treat it surgically unless it's causing extreme pain. So you need to do other measures to reduce the discomfort that comes from having a bunion. You can use wide toe box shoes. Don't use narrow, the very pretty looking shoes with, very narrow at the tip, even though they look very
Mm,
nice, but it's very bad for your feet.
very
Yeah.
sakit, I find them.
So you need to use wide box shoes, and they also have all this. It's called a bunion corrector, but it doesn't really correct the bunion. It just gives you more comfort because it slightly straightens out your toe. You can use that as well. You can use
Mm,
insoles, gel pads, things like that to reduce the symptoms. Now, in very rare cases, if your bunion is causing you too much of pain or the deformity is too severe, then you can
mhm.
correct it surgically.
I see. Okay, got it. Thank you so much, Doc. All right, next question is from Raja Lakshmi Krishnamurthy. Hi, Doc. I am turning 65. I would like to know if jumping jack is advisable for my knees. First of all, Raja Lakshmi, if you can do jumping jack at 65, I got a lot of respect for you. Kind of thing. Doc, please answer though.
Yeah, yeah. Well, okay, you can do jumping jack, but it's going to increase your risk of damage to the knees, cartilage, and all that because you're already 65. So I would advise a little bit more of a less stressful exercise to your knees. Something like jogging, okay, cycling,
Mhm.
okay, swimming, okay. Jumping jack sounds very intense.
Kind of thing.
Yeah,
But if you can do it, I just gotta respect you. That's all. I'm not saying you
yeah,
should do it,
yeah,
but I got a lot of
yeah.
respect. Yeah. Kind of thing. All right. One Muhammad has a question. One Muhammad Hazik, doctor, based on my experience, I've been playing soccer for almost 15 years.
Yes,
However,
yeah.
I noticed most of my friends got ACL and etc. But I do not know is it I had felt the pain and didn't check until now because I rarely felt like so much pain on my leg and knee. Or maybe your advice is I prefer to go and make checkup because I actively still playing and most every week. All right, what do you say, doc?
I think if you had an ACL injury and you're still playing soccer, you would know it by now. If there's no
Because
problems, because you have
because
some form of instability or your knee will give way or you'll have pain, some symptom will show up. But the fact
Mhm.
that you're playing soccer for 15 years and you got no problems at all, I think then it should be fine. Lah. You don't have to.
When I was reading, I said, well, Muhammad, I think the way you play soccer, your friends should learn from you,
Yeah,
because I
yeah, yeah.
think
That's
your
the
form and technique is very good, and you're
very good.
probably doing, and you're probably doing everything right. You're probably, what's that thing you said, have to warm up,
Warm up. Yeah,
and then during apa kena buat apa, and then lepas kena buat apa. You're probably doing everything right because you don't seem to have
that's
any
right.
problem. Yeah. So make
Yeah.
sure your friends learn from you, okay?
Yes.
Yeah. Good job. All right. Yiki has the question. Which sports have the highest risk of injury? Ooh, okay, that's a good one.
High risk sports. I think for now, I think it's rock climbing lah.
Rock
I would
climbing. Okay.
classify rock climbing. Yeah, I have a lot of patients who fall down while they rock climb and then they get these ACL injuries, fractures, ankle injuries, and whatnot. So my answer
Wow.
would be rock climbing.
Okay. All right. Okay. Next question is from Rita. I think after this, we're going to go to the quiz. All right. So
Okay,
let's go
all right.
with Rita. What sports do you recommend for senior citizens? Very good question. What's the best for them?
Senior citizens, I would recommend cycling, slow, brisk
Mm.
walks, swimming.
Because
Yeah,
swimming, there's less pressure or
impact
whatever.
on your joints. Yeah.
Yes, impact kind of thing. All right, cool. Very, very good question. Thank you, Rita. And thank you, Doc. All right, let's take a look because we're going to go into our quiz section. It is quiz time. And as mentioned in the earlier part of the show, we have some awesome prizes. And today it is a laptop bag up for grabs. But what do you need to do in order to win? First, you got to be sure to share this video out at least 3 times. And remember to set the share post to public so everyone can see. Next, answer the 3 questions that we're going to show on the screen in a single comment, and you are on your way to win the prizes. So make sure you share the video out 3 times, set the share post to public so everyone can see, and then answer the 3 questions in a single line, all right? Or in a single comment, and then you're on your way to win. All right, so first questions, let's have a look. All right. Betul ke? Betul. Okay, so here's the first question. All sports injuries require surgery. True or false? If the pain goes away after a few days, there's no need to see a doctor. True or false? Warming up before exercise can prevent injuries. True or false? All right, so I'll repeat the question. All sports injuries require surgery. True or false? If the pain goes away after a few days, there's no need to see a doctor. True or false? Warming up before exercise can prevent injuries. True or false? Let us know your answer in a single comment. All right. Now let's go back to our Q&A. Yiki is asking, does ice pack help and hot pack? How do I know when to use which? Ooh,
Okay,
good question.
so yeah, I always tell patients before you start your physiotherapy, your exercises, use a hot pack first to loosen the muscles. All right. Then you do all your exercises, get your range of movement and all that. Now, after you do this, most of the time for patients who just underwent an injury, who just had an injury, it will swell up. Now, when the area swells up, now you put your ice pack to reduce the swelling. So
Okay,
that's how you decide when to use hot and ice.
Okay, perfect. Thank you so much, Doc. Next question is from Hanan. Hanan Abdul Aziz. If my leg hurts, can I get a massage for it, or will it make things worse? I love this because our culture is immediately massage, kind of thing. So what's your take on this, Doc?
Okay, I love massages, but you need to make sure you don't have an injury first. If you have a fracture, if you have a ligament injury, don't just go for a massage. Go to the doctor first. And if everything is okay and the doctor gives you a good go to go for a massage, then yes, please go ahead.
All right. I hope that answers your question, Hanan. Go to the doctor first, kind of thing. All right. Okay. Yiki's question is, how does flexibility help in injury prevention?
All right. So if you're not flexible and your muscle or tendon is very stiff, when you do sudden exercises, the muscle will contract in a sudden movement, and that will cause the tendon to just go like that and rupture. That is how Achilles tendon ruptures usually happen. So that is a very common injury that happens in patients who we call weekend warriors. Sudden sprinting, you didn't warm up, you're not flexible, you just suddenly sprint, the muscle just contracts, the tendon elongates, and it ruptures.
Wow. Okay. So flexibility is very important, which is
Very important.
definitely true. Yeah,
Yeah.
especially as we age. Yeah. This is
Yeah.
no question. It's a comment. Hi, Nina. Hi, Doc from Sakina. Both so pretty. Yes. Thank you. Kind of thing. All right. Okay. Ashraf has a question. Ashraf's question is if Ashraf Ashraf, by the way, if you have a bigger body size, how should you start exercising? Is jogging a good option or should you focus on other types of cardio? Some people say running may cause knee injuries. Is that true? I love this question because I'm also on the larger side. So, what would be your answer, Doc? Yeah.
So, for someone who has a bigger body size, yeah, you're right. Jogging and running can cause more injuries to the knee because your body weight itself is going to be causing more injuries. So, yeah, I would suggest something like not weight bearing, cycling and exercises, swimming exercises first. Reduce your body weight first, and after that, maybe you can try to do all this jogging and running.
And start slow and progressively, I guess, right?
Exactly.
Would be good
Yeah.
as well. Okay, kind of
Yeah.
thing. Think of yourself as training for the marathon. You don't immediately
Yeah.
go 40 km. You
Yeah.
start slow and
Yeah.
build it up.
Yeah.
All right.
Yes.
We've got two more questions before we announce the winners. So hang in there, ladies and gentlemen. Zain Zaini wants to know, how do we know that our ligament is broken?
Mm. So how do you know that your ligament is torn? It's usually,
Mm.
like I said, pain that doesn't go away or instability. You feel wobbly, your knee or ankle feels wobbly. That's how you know that something is not right, something is torn. Because the ligament is not able to stabilize your joint. So that's why
Mhm.
you get this instability symptoms. That's a warning sign that you may have a torn ligament.
All right. Okay. Two more questions here. Prabhavati Sudesh Kumar, what to do with constant knee pain? What could it be? Constant knee pain.
It could be so many things. It could
Mm-hmm.
be arthritis. Is it after an injury? If it's after an injury, it could be a ligament tear.
Mm-hmm.
So I need more history before I can tell you what to do with constant knee pain.
Okay, but I guess what you would advise is because it's
Yeah,
constant, I
constant.
come and
Yeah, you got
see
the
a
answer right.
doctor. Yeah,
Yes. Yeah,
kind of thing. Yeah, which is what we spoke about. Time to see a
exactly.
doctor, kind of thing. All right, last question from Sakina. What kind of injuries do racket sports like pickleball, etc., cause? I think this is really important because racquetball is all the rage right now, right?
Yeah. So I think pickleball can cause injuries like ACL tears, meniscus injuries, and even ankle ligament tears as well. Actually, I've had all of these in patients who have played pickleball.
Mm-hmm.
So that's the kind of injuries you can expect.
Wow. And is it more serious than tennis? I guess because it's a smaller space and I don't know, the floor is different, more impact. I don't know.
Um,
Just asking.
I don't think that smaller space really matters, but the fact that
Mm-hmm.
you do sudden stopping and sudden sprinting, right, when you play pickleball,
Ah,
that is the one that increases the risk of injury. And also the fact that so many people are playing pickleball now, that is also the reason for the sudden surge in sports injuries.
all right, got it. So the sudden interest and sudden search, and we don't know. We
Yeah,
could be from weekend warrior suddenly to pickleball,
yeah, yeah,
passionate kind of thing. So that could be
yeah.
the problem. All right. So
That's right.
we have, yeah, kind of thing. All right. So we have actually got the answers to the quiz. But before that, let's find out what the correct answers. I mean, we have the winner. So let's find out what the correct answers is, right? So, Doc, if you can help me. Yeah. So,
Sure.
first question is, all sports injuries require surgery. True or false?
False.
Yeah, we told you there's no reason to be afraid to come in and see the doctor because not everything is about surgery, all right? So the answer is false. Next question is, if the pain goes away after a few days, there's no need to see a doctor. True or false, Doc?
True, if no other symptoms.
True, if no other
Yeah,
symptom. Okay. Warming up before exercise can help prevent injuries. True or false, Doc?
true.
Okay, so the answer is false, true, true, correct?
Yes, correct.
Okay,
False, true,
got it.
true. Yeah.
So let me just double check if we've got the right winners, Yiki.
I
Are we
think your
good?
second question is a bit of a trick question, lah.
Ah, okay, okay, okay. So it's a
Yeah.
trick question. So it could be
Yeah.
a false as well. Okay, but
Yeah,
anyway, we have
because
chosen. Huh?
because technically, yes, if the pain goes away after a few days, you don't need to see a doctor. But if you have other symptoms and all that, you still need to come and see the doctor. So you can take it both ways based on what we
Okay,
spoke about just now.
got
So
it.
maybe it's a bonus answer.
Bonus answer. Okay. Regardless, we've already picked our winners. So, and our winners are, let's find out. Our winners are Rita Liao, Jasmine Hing, and Maureen Lam. So, winners are Rita Liao, Jasmine Hing, and Maureen Lam. Congratulations to all our winners. We're going to be contacting you after this within a day to get your details. So, be sure to check your Facebook Messenger inbox. All right. So, if you're a winner, please do check your Facebook Messenger inbox. We're going to send you information within that one day. Congratulations, all. Thank you so much, Doc, for today. It has been very insightful. I definitely learned a lot, and I've got like some shoulder things, so I need to come see you soon. I think kind of thing.
Sure.
Yeah. And if
Yeah.
you've just tuned in and you love and you're learning so much from this episode, please give our Doc a round of applause and let us know in the comment what was the biggest thing you learned. For me, don't be a weekend warrior, warm up kind of
Yeah.
thing, and relax your muscle and of course proper technique and gear, very important. And I now know what a flat foot is and is not.
Yeah.
Thank
Okay.
you. Right.
All
Thank you
right.
so
No
much,
problem.
guys. Yeah, definitely appreciate the tips. If you love the tips from today, the info and insights, and you know it's going to make a difference to somebody out there, please tag your friends. Give us a lot of like and love while you're at it as well. Thank you again. I'm Nina Shahril Khan signing off, and we have Dr. Gaia with us. Thank you so much for tuning in. And Dr. Gaia, thank you so much for all the knowledge and sharing
It's my
kind of
pleasure.
thing.
My
All
pleasure.
right.
Thank you for
Thank
having me.
you. Thank you and
All
goodbye.
right.